Okay. Well, again, thank you for your patience and good afternoon. Thanks for joining us for this update on measles and immunizations as Wisconsinites prepare for spring break and travel. There isn't a news release associated with this media availability because you're all aware, of course, of the outbreaks in Texas and in other parts of the country. But joining us to answer your questions today is Dr. Jasmine Zapata, the Chief Medical Officer in the DHS Bureau of Community Health Promotion. And we'll begin this afternoon with remarks from Dr. Jasmine Zapata.
Hello. As mentioned, my name is Dr. Jasmine Zapata, and I am talking with you today as Chief Medical Officer of our community health promotion and also a board certified pediatrician and board certified preventive medicine doctor. We're here today to talk about the measles outbreak in the United States and talk about how we can keep Wisconsinites safe. As of March 6th, of 2025, there have been a total of 222 measles cases that have been reported in 12 US jurisdictions. We want to talk today about how we can work together to prevent that outbreak from coming to Wisconsin. As of right now, there are no measles outbreaks in Wisconsin, and we want to make sure to keep it that way. As families begin to prepare for spring break travel, it's so important to plan ahead so that we can stay safe. So first of all, what is measles? A lot of people think that it's just simply a rash that's caused by the virus. However, there are certain symptoms that develop before, such as a very high fever, a runny nose, cough, red, watery eyes, sore throat, and sometimes even tiredness. The rash can appear 3 to 5 days after the first symptoms. And a lot of people think, oh, it's just going to be a rash. We don't need to worry about it. But why we are so concerned about measles and want all of us to work together to prevent it from coming as an outbreak to Wisconsin is that measles is extremely contagious. It's extremely contagious, and it can be spread from person to person very easily. If one person gets infected, up to 90% of those in close contact with them can be infected as well. And this is something that we do not want to have to worry about in Wisconsin. In addition, measles can cause complications, and also it can cause students to miss school for a prolonged period of time, and Wisconsinites to miss work for a prolonged period of time as well. So let's work together to prevent it. And why does this matter? We really want to make sure that our children and our families stay safe, especially around this time of spring break travel. So how can you stay healthy against this? 2 doses of the MMR vaccine provide 97% protection against measles, and then 1 dose provides 93% protection. Getting the MMR vaccine, making sure you're up to date is a critical tool in your toolbox for keeping yourself safe and also others around you, especially as we go in this spring break season. Many people wonder, how do I know if my vaccines are up to date? You can check your family's vaccination status on the Wisconsin Immunization Registry, or you can also talk to your personal healthcare provider. They can look into your unique situation. They can look into the last time you may have received an MMR vaccine to make sure that you're up to date and give you personalized guidance on your next steps. We are all looking forward to a relaxing and fun spring break, and we want to make sure that everyone stays healthy. And so thank you for your time and your consideration in helping to partner with us to keep Wisconsinites safe. And now I'm happy to take your questions.
Thank you, Dr. Zapata. And we will start with one question for each reporter. And if we have time, we'll come back around for additional questions. And our first question today belongs to David Wahlberg from the Wisconsin State Journal. David?
Yeah, hi, thank you. In addition to the vaccination recommendations you talked about, what else can or should people do to try to avoid measles? And I guess in particular, I'm thinking about airport travelers, given that a couple cases have potentially involved exposure in airports.
That is a very great question. The number one thing that we are recommending is to make sure you talk with your personal health care provider to make sure you're up to date on your vaccinations. That's the number one thing that you can do to make sure that you are protected. Other thing is basic infection prevention measures. They're very simple, but very effective, such as making sure that you are washing your hands regularly. Also, when you're traveling, it's a personal choice. However, there are some people who decide that they might want to wear a mask when they know that they're going to be interacting with people from other states. They're going to be doing travel, especially prolonged periods. That's not something that everyone has to do, but there are people that make their own personal decisions that they want to do that as well. So, really, number one thing is making sure you're up to date on your vaccinations and then doing the other basic infectious control measures that we talk about to prevent all diseases. Thank you so much.
Thank you. Now to Hope Kerwin from Wisconsin Public Radio. Hope?
Thank you. CDC data shows that Wisconsin has one of the lowest measles vaccination rates in the country in kindergarten age children. And I just wonder how vulnerable that makes us as a state to an outbreak like the one we see in Texas.
It definitely makes us vulnerable, and we are aware of those statistics, and that is why we're needing to partner with you all, partner with everyone watching to have a conversation with your friends, your family members, your colleagues about this. We definitely are at risk, especially because of our lower vaccination rates. DHS is actually actively working with community-based organizations to work within their communities to increase confidence in vaccines. One great example is the routine immunizations through community engagement grants. And you can get more information about that through our website as well. We also have a media campaign underway to raise awareness, and there's lots of other great resources on our website. So we are definitely aware of that, and we're working to fix that issue, and we need your support.
Thank you. Now to Katie Thorson from WXPR in Rhinelander. Katie.
Thank you. I just had a question about like concern for adults, either if they weren't vaccinated as kids or if they should be concerned about, they're older and, their vaccine not being as effective anymore, what you recommend for them.
That is a great question. I'm going to give some general information. However, I really want to emphasize for each individual, it's very important to talk with a healthcare professional so that they can get the unique and customized recommendations. But just in general, for adults that were born before 1957, there's they probably had measles and they don't need an MMR vaccine unless they're international travels or healthcare personnel. If there are adults that were born during or after 1957 who haven't had measles, they should have one dose unless they're part of some other special groups, like adults who are healthcare personnel, college students, or international travelers who don't have immunity. People who received a dose of measles from 1963 to 1967 may have gotten an inactivated measles vaccine that's not effective. And so those individuals should consult with their personal healthcare provider. CDC recommends for college students to have 2 doses, also healthcare personnel to have 2 doses, and then international travelers for sure. So as you can see, everyone has a unique situation. Children are recommended to have 2 doses as well. But as you can see, everyone has a unique situation based on their age, if they've had measles before, their place of work, if they're going to be traveling internationally. So the best thing to do, again, is have a conversation with your personal healthcare provider. Also, if you think that you need to get caught up on an MMR vaccine, they are also available in many pharmacies, many local pharmacies. So you can go and have a conversation there as well if you do not have a easily accessible healthcare provider to talk with. And then also you can reach out to your local health departments. They have amazing resources and information to help you know how to navigate this situation. Thank you for that wonderful question.
Yes, thank you. Now to Sarah Volpenheim from the Milwaukee Journal Sentinel. Sarah.
Hi, thanks. I'm wondering how you see any changes at the federal level potentially affecting the state's ability to track and respond to any measles outbreaks that might arise in the state.
Thank you so much. We are well aware of the changing federal landscape. In fact, we're having multiple briefings per week and huddles so that we can stay in tune with what's going on at the federal level. What we do know is that the things that are happening in the federal level do have impacts and implications right here in Wisconsin. That is the reason that we are staying laser focused on having conversations like this, spreading the word about our current status, and partnering with you all to help get out the word on how we can prevent a measles outbreak in Wisconsin. So we're well aware that there are changes at the federal level that can have implications here. And that is why we are here today, to make sure that people are getting accurate information, that we're being transparent, and that we are sharing resources so that everyone can have an opportunity to stay healthy, because that's our number one goal.
Great, thank you.
Yes.
We can go back to the top again with David Wahlberg from the Wisconsin State Journal. David, do you have another question?
No, I don't.
All right. Now to Hope Kerwin, Wisconsin Public Radio.
Yeah, I'm curious if the state is, with spring break coming up, and we know many people will be traveling, is DHS or our local public health officials doing any sort of surveillance for measles, or, how is the state kind of approaching keeping an eye out for this disease?
Wonderful question. At the state level, we have a phenomenal infectious disease team that are monitoring things very closely. And also, our Division of Public Health is in close conversation and communication with all of the local public health officers. In fact, there are regular meetings with our state health officer and the local public health officers. Everyone is well aware of our current situation. Everyone is well aware of the risks, especially going into spring break, and everyone is doing all that they can to keep close observation and focusing on prevention. We would love to prevent things from happening in the first place. That's why we're here today, to spread awareness. And when and if any outbreaks occur, we're going to be on top of that at the state level and at the local level. Thank you for that great question.
Thank you. Now to Katie Thorson from WXPR. Katie?
Is DHS making any recommendations in terms of like avoiding places where there are known measles outbreaks, and maybe suggesting that people change their travel plans if there's a known outbreak somewhere?
A wonderful question. At this time, there are no recommendations from DHS restricting travel or telling people they should or should not avoid certain areas. Every decision that individuals and Wisconsinites make is an individual decision based on the risks. And so everyone has to make their own personal choices. There are some families that get this information and they decide, maybe because of our personal situation, maybe because we have someone in the family that has higher risks of infection or is immunocompromised, this spring break, because of everything going on, we're going to limit our international travel. We're going to just stay locally. There are others who say, I have a sick loved one in another state, and they have to do a risk benefit ratio, and they might make the decision to still travel. So right now, DHS does not have any formal recommendations on where to and to not travel. The one recommendation that we do have for all Wisconsinites, regardless of if they're traveling over spring break or not, is to make sure you are up to date on that MMR vaccination. That is the one thing that we are strongly recommending. Thank you for that question.
Yes, thank you. And now back to Sarah Volpenheim from the Milwaukee Journal Sentinel. Sarah?
I'm wondering what, if any, proactive steps the state, in partnership with local public health officials, are taking to try to build trust with some of the under-vaccinated communities in the state, including like the Mennonite communities that we have in the northwest part of the state?
Wonderful question. We are building off of lessons learned during the COVID-19 pandemic. During that time, there was a lot of distrust with the healthcare systems and a lot of trust that was needed to be rebuilt. And we learned a lot of lessons. We forged many wonderful partnerships with local public health and community-based organizations. One of the things that we really learned from the COVID-19 pandemic was the power of partnering with trusted messengers to have conversations with various communities around our state and to individuals. When there are trusted messengers, people are more likely to engage in conversation and be open to getting vaccinated if they have not already. And so that's one thing that we're continuing to build on. We have a lot of strong partnerships, already existing relationships coming out of the COVID-19 pandemic, and we're going to continue to build on those relationships. That is a wonderful, wonderful question. Also, we also are working with community-based organizations to work within their communities through our RICE grantees. That stands for Routine Immunizations Through Community Engagement. And you can learn more about the RICE grantees on our website. But we're actually putting funding behind this. It's so important to connect with community-based organizations, people who are local, boots on the ground, and who are trusted messengers. Thank you for that question.
Thanks.
Thank you. Have a little bit of time left, so we can go around the horn again, starting with David Wahlberg from the State Journal. David?
Sure, I thought of a question since the last round. I'm wondering, the Vaccines for Children program, how is it funded, and are you concerned about any changes in funding that might be coming?
Wonderful. In general, we are having, I want to say daily, and it actually is daily conversations and scenario planning for a lot of things related to how the federal landscape and the things going on at the federal level could impact Wisconsinites. Right now, we are continuing with business as usual. We're continuing to move forward with the different programs that we have in place, and that's what we're doing for right now. We're moving forward with business as usual, but with caution. There's scenario planning that is taking place, numerous conversations on, no matter what's going on at the federal level, what are ways that we can continue to keep Wisconsinites safe? So that's ongoing conversation, and we'll continue to keep the general public updated as we learn more and have more progress.
Thanks, David. Now to Hope Kerwin from Wisconsin Public Radio. Hope, another question?
Yes, thank you. For individuals and families who are fully vaccinated and kind of up to date, I'm curious how worried or concerned they should be about measles and a possible outbreak, especially if they live maybe in a county that has a lower vaccination rate.
That's a phenomenal question. I would first tell those families and individuals, you are on the right track. The first thing that's so important is the fact that you are vaccinated and up to date. Congratulations for that. The second thing that I would uplift is that one dose of the MMR vaccine is 93% effective at preventing measles, and then 2 doses are 97% effective. So even if they are in an area where there are lower vaccination rates, if they get their vaccination, 1 dose is 93% effective at preventing measles, 2 doses is 97% effective. So that's some really good protection. And again, if there are individuals living in areas that have lower vaccination rates, that is the number one reason that they, especially more than others, should make sure that they are up to date on all their vaccinations. Great question.
Katie Thorson from WXPR.
I don't have another question. Thank you.
Okay, Sarah Volpenheim from the Journal Sentinel.
I think those were my questions as well.
Okay, well, we have a late addition, and that is Jeffrey McClure from Northern News Now. Jeffrey, what is your question?
Hi, thank you. I just wanted to ask if you, by chance, knew when the last measles outbreak happened in Wisconsin, and then just what we've learned from, the past having to deal with those.
Yes, that is a great question. I don't have the exact year, but I know that it was a very long time ago. That's what I'll say. We can actually get back to you with the exact date, but it was a very, very long time ago. It definitely hasn't been in the recent past. And the reason for that is because of the power and the development of the MMR vaccine. What I also will say is that adults who were born before 1957, they probably had measles because the MMR vaccine wasn't as widely used or developed at that time. So that before 1957 is when it was something that was regular. In fact, I was just in a conversation with some of my medical colleagues in the medical leadership team at DHS, other healthcare providers that work at DHS. And how can I say it? Some of my older partners that are more wise than I am and have been around longer, they were reminiscing about back in the day before there were MMR vaccines, how they actually experienced measles, and they were talking about how they just felt miserable, talking about how difficult it was and how long they were out of school for. And so we were actually just having this conversation. So adults born before 1957, they likely had it, and so that is the last time where it was something that was normal. We do not want to go back to that time period. Let's use all the tools in our toolbox that we have to keep Wisconsinites safe. Great question.
Thank you. And with that, we can conclude today's media availability. Our thanks to Dr. Zapata and to all of you for participating. You can find additional information about measles and immunizations on the DHS website. Thank you and stay healthy.